Welcome back to Casey Cares, Kansas City's nonprofit voice, telling the stories of Kansas City nonprofits and the people behind them. I am Bobby Keys.
And I'm Ruth Bombigas.
Yes.
And we're back.
We're back.
Sharing the great stories. We're still here.
We're still, yes. Thanks to the Ewing, Marion, Kauffman Foundation, who has generously underwritten us, and Charitable Communications, who produces the show. So, yeah, they're keeping us alive.
Keeping us alive. And if people like what they hear and want to support us, we'll always listen to that as well. They can go to our website at kccaresonline.org. We have James Stowe with us, representing the Mid-America Regional Council. And James is the Director of Aging and Adult Services. We're so glad to have you, James. Thanks for, finding time in this, what everybody thought was going to be a very boring time. I think it's crazier, busier than we anticipated. I don't know what you're finding.
Well, thanks, Ruth. Yes, we are finding this to be a heightened time of activity and production, so we are definitely busy.
But we'd love for you to be able to expand on what Mid-America Regional Council is responsible for. It's a big nugget.
It is. The Mid-America Regional Council is a convening organization and a planning organization that tries to work across governments throughout the region to bring everyone together on those kind of big issues that are too difficult to solve alone and can be more effectively solved together. So there are various departments ranging from early learning programs and Head Start programs to transportation and environment, many different programs, including aging and adult services, which is the program I oversee. And that actually is designated as an area agency on aging for the Missouri counties in the metro region.
Well, when I was doing a little bit of homework for the show, it gets away from you if you're not always involved with an organization. 9 counties and 119 cities.
That's right, big region.
Pulling all those folks together around issues must be a little challenging.
Of course, that you have divergent interests and a lot of different unique contexts for each of the partners that we work with. But there's oftentimes unifying themes bringing people together, and really an awareness that if you're collaborating across jurisdictions, you can be a lot more effective than you'd ever be able to be so on your own. So that's sort of a motivation to get people together and work towards a common goal.
Now, the Director of Aging and not older adults, but adult services. I guess you direct us that we can age. I'm kidding. But what does that throw you into? What kinds of issues and things are you dealing with?
There are a lot of different organizations focused on geriatric health in the medical field and other issues pertaining to aging. We really narrow in and focus on social health issues that allow people to thrive in the community for as long as possible. So even as far as social health services like transportation, nutrition of various types, all types of services that would help people maintain independence in their own homes for as long as possible.
So pre-COVID, give us an example of what that would have you doing and who are you doing that with?
We, as a common point in the Mid-America Regional Council, we're always doing things through community partners and local governments. So we contract with many local community-based organizations and jurisdictions, and they run programs and do direct service that touch people in their lives day to day. So common programs include home-delivered meals, where you either get a hot daily meal or a box of frozen meals, helping people just with the ability to stay fed and have nutritious food in front of them, even when their ability to cook for themselves or get out of the house to go to the grocery store is a little more complex than it used to be.
So what's the number of folks that you're touching then through the various sort of endeavors?
We touch about 8,000 unique individuals, either older adults or people who are 18 to 59 living with a disability each year. Some of that is more intensive than others. Some is just providing them information and referral resources over the phone. But a lot of it's direct service. For instance, we have about 2,500 individuals who are regularly enrolled in our home delivered meals program.
That's incredible. So
yeah, it's big service.
And is there a way to boil that down for us even more and give us, what does that mean to have to put those meals together, and where do the resources come from?
So a lot of these resources will come from federal programs through the Older Americans Act, and then the state also offers state general revenue funds to kind of input as well. And then a lot of local funding comes through the counties, or even some cities are contributing. And those funds all come into really local community-based organizations who might have their own kitchen in a site, and they're baking and making meals each day, packaging those meals and getting them out. Places like Don Bosco, Guadalupe Centers, the Shepherd Center of Central Kansas City, all of those partners are kind of doing that every day. And we also have to bring in, for the volume of clients that we experience, we have to bring in some partners to do frozen service, and they're producing meals at a commercial scale and helping us get those out into the community as well.
Now enter into the world of COVID. How has that rocked your world? How has that changed things? What's happening because of the limits that the pandemic has put on contact?
Yeah, we had a unique sensitivity already to people who had difficulty leaving their homes. They were homebound already. And, now most of us are homebound, and we're really gaining a deep empathy for what that means day to day for folks. And the pandemic disrupted everything that we do. And we had a lot of programs that involved really social activities, congregate meals, where folks would go to a senior center and sit down with their friends and have a nice hot lunch, do other programs and educational activities at those centers. We would do health promotion and other education type of activities in group settings. All of those had to come to an end because of the folks that we serve being so high risk and vulnerable for complications from the virus. And then there was a strong focus on supporting people as they try to stay safe and isolated in their homes. And that really involved providing them with care management, which is professionals helping to connect you with resources that you may need, as well as nutritional support, such as home-delivered meals.
Have you found that there's been more of people wanting to volunteer to help out during this time? Is that still kind of a struggle for you, as well as it is for most nonprofits?
That's a great question. We've seen an outpouring from the community in support of various ways, and volunteers especially have come out. MARC itself in my department isn't the best situated to really take in volunteers and help them have an active role in the community. So we refer them and help them connect to those community-based organizations that are really on the front lines that we're helping to support. And we've made many of those connections during this period. And I know we've heard reports that a lot more volunteers are coming into the system, and I hope they stick with it.
Well, there's been lots of conversation, I know, coming from the Kansas City, Missouri mayor and others, that in the beginning it seemed like there was a lot of cross-community cooperation. Now everybody seems to have settled into kind of a different situation, and I don't want to say there's any kind of battles, but there seems to be a little more polite disagreement. What are you observing, since you are that regional body?
Well, I can't talk necessarily for all of those issues, but just from an aging perspective, we serve adult humans who have their own way of thinking, and they're on the spectrum of belief about staying safe at home, et cetera. And so we kind of walk that line and just help to listen to people and see where they're at, and really a lot of this emergency is contextual. So it might be really difficult in some areas and a little less of a burden in others. And there's room for some of that difference in thought. We have not experienced in our systems, in aging at least, any real disagreement. We're all serving highly vulnerable folks. Many of our clients are of the opinion that they don't want to be out and about and at risk for being infected by the virus. So we've, at least so far, seen quite a bit of unity on that issue.
That's great to know. How within MARC itself are you all working? And by that, I'm assuming you're not in offices. That we understand. But in terms of resourcing or think tanking, even though you're in aging, let's say, you've got, preschool, young education. Can you share with us what's going on? Give us the inside look.
Yeah, I mean, MARC is both collaborative externally and internally. So we actually have quite a bit of conversation going on inside the organization and frequent exchanges of ideas. We instituted a virus task force among various leaders and elements of the agency for the beginning. And that just helped us kind of get a view of what was happening out in the community and where we could help and bring our resources to bear. And that also spilled out into various community groups that are meeting really around issues or topics, but also around how the community is funding nonprofit organizations and bringing grants to bear. There's just an activity really all over the agency, and we try to talk regularly amongst ourselves and see where we can cross-pollinate and have ideas kind of flow back and forth.
Well, we like that cross-pollination. Are you talking about the next 30 to 60 days, the next 6 months at this point as a regional body, what that may look like?
Yeah, I mean, isn't that top of everyone's mind? What are things going to look like as it scales down, and what happens during a resurgence and cases? And I think everyone does have that top in mind. I can share that we've received a lot of funding for aging services from the Federal Relief Act. And that's great support. We're able to we've increased home delivered meals, for instance, by 85% in our services, all because of those funds that have become available. But what will that look like in the winter as resources are dwindling over time and the state is really both states are entering into budget crisis? Certainly we might have de-enrollments in the winter or other complications that we'll really have to tackle head on. But MARC always as an organization is looking pretty far down the road. And there's always a fine line of looking far enough that you can make a difference and be planful about your next steps, and trying to look too far and then everything becomes murky. But certainly how this is going to scale down over time is top of mind.
How can folks find out about accessing resources from you or from partners in what you are doing? For those who are specifically interested in aging services, or they have a loved one who really can't get out of the house or has some pretty high need, and we of course focus on those who are the highest social and economic need, they should call our information and referral line, and they can talk to one of our representatives and get connected to services. And that phone number is 816-421-4980. Otherwise, if you're just a general community member really interested in kind of what's going on at a regional level, there are some websites available. The Prepare Metro KC website is talking about COVID response generally across the region. And then any municipality or county government website is a great resource, including the public health websites. Well, we're so glad that MARC is there and helps leading the charge and trying to get us all to play in the sandbox in a good way to keep us moving forward and not getting mired down in minutia. I have to ask you real quickly, curious how you got into the world of aging. You are fairly young, at least by the lovely photo I saw, but always interested how a younger person enters that world.
Well, that's a great question. I was impressed upon by my grandparents. They were a big part of my life growing up, so I always had kind of a sensitivity to older people. But really, as an undergraduate at K-State, I sort of was exposed to this idea of this rapidly aging population and how this is going to be different than anything that had happened in history to this time. And I wanted to be a part of that, and I had a few course opportunities, and then that led to actual degree opportunities and research, and that kind of led the course of my path. And was very happy to arrive at MARC about 3 years ago and really take on this role.
Well, we're certainly lucky to have you and leading the charge and leading us through it. Again, if you've got questions about aging or anything along those lines, check out MARC. It's marc.org. And James, thanks so much for spending time with us.
You're very welcome. Thank you.
Inspired by Ewing, Marion, Kauffman, the Kauffman Foundation believes that every person, regardless of their background, should have the opportunity to learn, to take risks, and to own their success. Working together with our Kansas City community and beyond, we take on approaches that break down barriers, providing people with the necessary skills throughout life to make or take a job and ultimately give back to their community. By listening to the communities we serve, tap into our learnings and relationships, and bring everyone together to build and support programs that improve education, boost entrepreneurship, and help Kansas City thrive. Learn more at Kauffman.org.